About reversible diseases. Know that these are reversible with a healthy diet, like whole food, plant-based diet. You can do this on energy drink, but a whole food plant-based diet and beneficial lifestyle practices, enough sleep, a daily walk, loving your life. The healthy plant-based diet, that's the key to reversing. The beauty about a whole plant diet is that now it's meal after meal, salads, soups, steamed vegetables, turmeric-rich curries and chilies. And each one of these whole plant meals sends a surge of antioxidant molecules that quench free radicals, that molecules that promote tissue repair, that promote membrane healing. It's a high water content diet. It's like taking yourself to the car wash and just flushing your cells clean with all the water, the soups and the salads and steamed veggies. Changing from an animal-based diet that most people eat to a plant-based diet changes everything. When practicing lifestyle medicine, I get to lean across the desk and say these words that my conventionally trained colleagues never get to utter. I get to look at the pictures now and say, how'd you like to get rid of your high blood pressure? How'd you like to get rid of your type 2 diabetes? How'd you like to get rid of your lupus? How'd you like to get off these medications? And this is what happens when people adopt a healthy whole plant diet and take a walk every day and bring those positive lifestyle choices into their lives.
Is something standing between you and your happiness? It was for me. I had to face my depression and the constant negative self-talk. Therapy helped me realize I deserve to be happy. That's why this podcast is called I Choose Health, because I made the choice to heal and I want to share that with you. As a gift to you, we've partnered with BetterHelp as our sponsor to help you start your own healing journey. We all face moments when life feels overwhelming, whether it's stress, anxiety, or just feeling stuck. Talking to someone can make a real difference. And that's where our sponsor, BetterHelp, comes in. BetterHelp offers professional online therapy that's convenient, affordable, and entirely on your schedule. You can connect with a licensed therapist by video, phone, or even chat, whatever works best for you. Let our sponsor, BetterHelp, support you on your journey to better mental health. You can get 10% off your first month by going to betterhelp.com/iChooseHealth. That's betterhelp.com/iChooseHealth for 10% off your first month. Take the first step toward feeling better today.
As a teenager, I decided to live better, so I gave up the meat, eggs, and cheddar. At 20 and 30, I wanted more, so I strengthened my mind and my core. Living a life that is healthier and wealthier because I choose health.
So, guys, I've been thinking about, the experiences that I've had with, friends, family, and, there are people that I have, stood with through their particular illnesses, both friends and family. And, time and time again, being with them in the hospital, one thing that's been consistent, unfortunately, is that the doctors, the people who are there in their final moments, are not directing them towards solutions that are, natural based. They're not founded in actual healing and health. And so I'm really blessed and happy to have with us today someone whose research and life work has been spent in looking into these solutions, these alternatives as to how to heal and to repair the body and to maintain the body in its most optimal and best way. So, guys, without further ado, I want to invite Dr. Michael Klaper to the I Choose Health podcast. Dr. Klaper, welcome to the show.
Oh, thank you very much. It's an honor to be with you and your listeners. I'm glad to share this information today.
Yes. Dr. Klaper, I want to also shout out Robert Sheik, because he's the one that made this interview possible, and just an amazing guy who's really committed to this cause, just as you are, just as I am. And, I'm really excited about your new book, your new work called Moving Medicine Forward. which is coming out in April, I believe April 7th of this year. And so I want to start actually in the first chapter where you speak about the etiology, right? The causation of heart disease, and how you speak about there not being any solution given or any etiology given in regards to that. Speak a bit on the mindset of the medical industry as to why there's really no real alternative or real solution given, and rather we see one that is bending more towards medicine and things that will benefit the medical industry more than it does the individual.
Oh, well, that's a very profound question that really gets to the heart of the issue here. And I've been a physician for over 50 years, and I thought I would be practicing blood and guts medicine in emergency rooms and operating rooms all my career. But partway through my career, I had an epiphany involving my own health. I changed to a plant-based diet. My body loved it. Within 12 weeks, 20-pound spare tire of fat melted off my waist. My high blood pressure went to normal. My high cholesterol went to normal. I felt great waking up in a nice lean body every day. And I realized that the reason why I'm facing this, and all our primary care colleagues are facing this steady river of people who are in these bodies, overweight, hypertensive, with high blood pressure, diabetic, atherosclerotic, inflamed. And it's clear it's from what they're eating. It's what they're running through their arteries every 4 hours. And done month after month, year after year, it creates these bodies with all these diseases. And once these diseases become manifest, my colleagues are dumbfounded. What happened? Well, just bad genetics, I guess. They're genetically foredoomed to become overweight and have clogged arteries, and uh, and we really don't know the underlying cause of this. And they can kind of retreat into this fortress of willful ignorance, and that's a powerful phrase, but the idea of delving into what the patient is eating every day is so formidable. It's so forbidding to the medical profession. Why? We're not taught anything about nutrition in medical school. Just blow right past it. Oh, it's cultural. You can't talk to someone from Hispanic heritage or South Indian heritage about what they're eating. That's not for me to be able to tell them. And besides, food doesn't make any difference. The body will sort out whatever you eat. The body will take what it needs and get rid of what it doesn't. Never been any studies showing that food makes any difference in these diseases. And again, the wall of the fortress of ignorance gets higher and higher because the truth is just the opposite. We do know the key role that food plays in these diseases. We do know that these are reversible diseases with a healthy plant-based diet. And yet my colleagues they don't want to open that door. And so it's easy for them to say, "Oh, etiology unknown. We don't know the cause of these diseases." And it's true, not teased out every last interaction between every gene and every enzyme. And there's a world of discoveries waiting to be made in that world, and bless all of those earnest researchers working in those labs to tease out the molecular mechanism. But to say that a diet of cheeseburgers and buffalo wings and pepperoni pizzas and beer do not exert their toll upon the system and isn't the major driving source of these diseases, again, leaves me dumbfounded. To the point that we have to do something about it, and that's what the book is about. What are we going to do about this abysmal pit of ignorance that my colleagues carry around with them when it comes to our patients' diet?
You've been in the medical industry, I would say, for the better part of half of a century, right? And what do you think is the underlying cause or motive behind you have an entire establishment that keeps pushing against the idea of food being a viable option for healing the body. And I always find it so funny. We talk about it on this podcast all the time, where you have Hippocrates who talks about letting food be thy medicine, and we have doctors who are taking the Hippocratic oath, and it seems like we go far away from Hippocrates' thinking, Hippocrates' ideology when it comes to health, when it comes to healing. What do you think is the major edifice or structure that's kind of pushing against that idea?
Boy, your questions are very perceptive. You're right to the core of the issue. So you're asking, what is the cause of the resistance? And it's multi-layered. As I mentioned, nutrition's just never been included as part of the standard medical curriculum. So doctors complete ignorance. Listen, I don't know anything about nutrition. I wasn't taught anything about it. I don't get paid to do this. I don't. I've got. Only have time to do this. I got a waiting room full of sick patients. This don't bother me. This nutrition stuff. So it's easy to discard it on an individual doctor level. But below that, there's a core of resistance factors here, to bring in the patient's daily diet. Now, as far as both the cause and the cure of their disease, really breaks down a bunch of inherent barriers in the process. What do I mean by this? Well, one, bringing the patient's diet in disregards the current, it breaks their model of disease. All disease is genetic, there's environmental factors, there's viruses out there that they have to cause. Food has nothing to do with this. So there's this initial roadblock, but also what I'm advocating, because these are diet-related diseases, and the patient will benefit by transitioning their diet to a delicious one based predominantly on whole plant foods. To choose the bean chili instead of the beef chili, to make a vegetable curry instead of a chicken curry. It's not that great a sacrifice. But this means bringing in the dietitian and the food coach into to the health team. Oh, the insurance structure won't pay for that, so we can't do that. So this important ally is not enlisted. The patient is stuck throughout their own. And of course, there's a financial barrier. If people really start eating a whole food plant-based diet, then we're going to have a far fewer clogged arteries, far fewer strokes, far fewer cardiac stents placed in arteries, far fewer chest open for coronary artery bypass, far fewer beds occupied in the intensive care unit. Well, these, of course, are money-generating procedures, and if those go down, it threatens their financial model. So all the way around this edifice that has been constructed of diagnose a disease, get around the right medicine, send them to the right specialist, and we've done our job. That model has been so firmly encrusted, so it's become calcified in our healthcare system, that those are the main barriers. It's easy to plead ignorance and just keep the money flowing by doing more and more procedures. And it's sad, and everybody loses. The patient loses most of all. They lose the opportunity to actually reverse their disease. In practicing lifestyle medicine, I get to lean across the desk and say these words that my conventionally trained colleagues never get to utter. I get to look the patient in the eye and say, how'd you like to get rid of your high blood pressure? How'd you like to get rid of your type 2 diabetes? How'd you like to get rid of your lupus? How'd you like to get off these medications? And this is what happens when people adopt a healthy whole plant diet and take a walk every day and bring those positive lifestyle choices into their lives. These diseases reverse; they go away. They're not permanently imprinted upon the person's physiology. These are conditions produced by improper fuel being fed into the body. We'll get them on plant-eating hominids, get us on that plant-rich diet, and the arteries relax and the high blood pressure comes down. the inflammation subside, the joints stop hurting, the asthmatic lungs stop wheezing, that they turn into little healthy people right before our eyes. So the patient loses this wonderful transformation. The doctor loses the opportunity to have the most satisfying moment in medicine to watch their patients regain their health and help them regain their health. At the end of my slide presentation to the medical students, I have a slide that says, knowing how reversible these diseases are with a healthy diet and lifestyle, you want to heal these patients or just want to manage their chronic disease. Why are you going into medicine? Want to heal these patients? Get real about why they're sitting in front of you, doctor, in these bodies, overweight, hypertensive, diabetic, atherosclerotic, inflamed from what they're eating daily. Deal with that and you will help them regain their health. But society loses with this patch hole in the dike uh, approach that we have to healing here, to stent the artery open, etc. Because the patients still go on getting their heart attack, they still get their strokes, and every time a breadwinner in a family goes down with a heart attack or stroke, not only have we lost a creative, loving member of our society, but we've lost a taxpayer too. And so all the rest of us have to pick up the slack because we still got to pay for fixing the roads and college scholarships, etc. Certainly the animals lose big time. No one's saying anything about changing our diet. We wind up killing hundreds of millions of animals every hour. 600 million chickens get their throat cut every hour in this country. That horror will continue. And the planet loses with the business as usual, our business as usual medical approach. Because the meat-based diet is why we're cutting down the forests, why the soils are eroded, why the rivers are drying up. Everybody loses with this model that has coalesced for the doctor, patient, make a diagnosis, treat them with medicine and surgery, done your job. That's 1920s medicine. We need 21st century medicine. Why does that patient in that body, from what they're eating and how they're living their lives, you owe them, doctor, the truth, and to help them regain those dietary practices that will really help them gain their health. That's what our book's about.
I'm glad that you mentioned that that's like a 1920s model. And it reminds me of, we go back to 1906, where you have the whole thing with Upton Sinclair and the jungle and that idea of a need of a change in the way things are done medically and societally, where we make things and environment healthier for individuals. And as you were speaking of this model, explain to us a little bit further what you're talking about when you mentioned a toxic ragtide.
Yes. Again, the whole concept of nutrition in medical school has just been broken down to a little side pocket of biochemistry. Well, here's the Krebs cycle enzymes, and here's the vitamins rolled with this. If you don't have enough vitamin C, you're going to get scurvy. And you don't have enough riboflavin, you're going to get pellagra. And that's all we're really basically taught. And the effect of the patient's daily diet on the body is so profound, and yet in first med school, no one mentioned it to me, and it's the key mechanism by which these diseases get instigated. What does this mean? Well, when you bite into that cheeseburger, and there's cooked, cooked cow muscle there, along with the dairy protein, the saturated fats. And all that gets added in is the burger is grilled, the cholesterol in the meat patty gets oxidized. So now you're eating oxidized cholesterol. It's full of saturated fat, a wave of saturated fat floods through the body. And it's as the chicken is fried or the steak is broiled, these molecules called free radicals, you rip electrons off various atoms, and now you've got these atoms that are shorter electron, and they're like molecular terrorists that will rip electrons off any passing protein. They'll rip it off your DNA, your cell membranes, and the burger and the French fries are teeming with free radicals. That comes from cooking meat. Steaming broccoli does not create free radicals. Boiling rice, making oatmeal does not create free radicals, but cooking animal flesh does. The animals in the feedlot are fed bushels of grain sprayed with pesticides and herbicides. They're fed antibiotics as growth promoters. All of these toxins accumulate in the animal's flesh. So when they bite that burger, a flood of those molecules, the pesticides and herbicides and bioconcentrated uh, antibiotics, microplastics, all that floods through the tissues. And again, broccoli, if you're eating broccoli, does not, you don't have to give antibiotics to broccoli. And so, in so many ways, and in my book, I go through 16 of these toxic molecules that flood through the tissue, through every cell in the body, with every meat and dairy based meal, typical of the standard American fast food based diet. And I put all these here, I'm calling this is the rich tide that sloshes through our tissues. And it affects our physiology for hours, 5, 6 hours at a time. Um, the body has to deal with these oxidizing agents, these free radicals, the fragments of animal muscle that leak into the bloodstream, the endotoxin that makes your blood clot. Again, the red tide is a formidable collection of the toxic molecules and and repeatedly flooding the tissues with this tide, meal after meal, day after month after year after year. Well, of course, the body's going to get inflamed. Of course, those arteries are going to react. Every tissue in the body will react, and this is the effect of the red tide. The red tide is my curve, but they're arguing the with the presence of these molecules and the damage they cause. And, it's repetition over time, meal after meal, year after year, that creates these bodies that then we have the audience, oh, well, you just need a beta blocker. You just need the ARB drug. No, doctor. They need to stop running that red tide through their arteries every 4 hours. And they need to adopt a food stream that is truly healing. The beauty about a whole plant diet is that now it's meal after meal salads and soups and steamed vegetables and turmeric-rich curries and chilies. And each one of these whole plant meals sends a surge of antioxidant molecules that quench free radicals, that molecules that promote tissue repair, that promote membrane healing. It's a high water content diet. It's like taking yourself to the car wash and just flushing yourselves clean with all the water and the soups and the salads and steamed veggies. Changing from a animal-based diet that most people eat to a plant-based diet changes everything, and it's a different physiology. The blood is less viscous, the microbiome is different, the hormones are different, the oxidative balance is different, the inflammatory reaction of that. You change the entire physiology. That's what lets these wonderful before and after changes we see on the websites of the plant-based Dr. Furman to North, these various websites. How do these people make how they change the fuel they're running through the body every day to stop the red tide? And the body knows what to do. The body will heal. And every medical student knows that. I wish someone had told me that in medical school. Changed course of my medical career. Someone told me, one, these are reversible diseases. Nobody told me. I wish someone told me high blood pressure is reversible. We get the opposite message. We get they will take these pills the rest of their lives. No one gets off hypertension. Diabetes, oh, once on insulin, always on insulin. Nonsense. Not the people who have type 2 diabetes because their insulin receptors are all clogged up with fat. Well, a whole plant diet is low in fats. You'll clear out your insulin receptors. Your own insulin starts working again. And not only can you get these people off insulin, you have to get them off before their blood sugar crashes to the roots. Same thing with high blood pressure. The arteries heal, the arteries open up, blood pressures come down. Not only can you get them off their blood pressure medication, you have to get them off they'll stand up and pass out on you from low blood pressure. So I wish someone had told me this. There's an art of de-prescribing medication. You got to get your patients off these medicines. And so that's what we're doing by going to medical schools with our moving medicine support program and telling the medical students that they are very grateful, very receptive to the message. So we've got a lot of work to do in medical education, but it's the most important area that I can work in at this point in my career. And let's get some nutritionally aware doctors out there who find a plant-strong dietitian, have incorporate him or her into their practice, and getting your patients on a healthy diet and watch them get truly healthy. That's how medicine should be practiced in the 21st century.
You've been doing this a long time, and I've been thinking about, and I'm drawing some parallels here between, when we say the term big government, and we're talking about government being overly involved in, our day to day movements. And I think about, I like to use the term big medicine, where big medicine is getting very much involved in saying how we should be responding to different things, our health or like whatever health crises are coming up. Um, and I wonder from you if you've seen a different attitude within the last 10 to 20 years of there being a leaning more towards big medicine versus there being a leaning towards other alternatives. Because, we obviously have explored different types of holistic approaches to health and healing. But would you say, and I know you speak in the book about the zeitgeist, would you say that there's been attitude within the last 10 or 20 years to lean more towards big medicine or in the opposite direction?
Oh my, so that's a profound question. And you're talking about big forces here. And you're right, I haven't thought about it till you posed the question that way. But you're right. In the past 20, 30 years, as a practicing physician, I've watched the rise of big medicine in a lot of ways. Um, uh, you'd be cynical as far as the money and the billions that big pharma pours in, and the meat and dairy industries pour into the medical schools. And along with this is an increasing almost militancy. You better toe this line, doctor. And the boards of medical quality assurance will haul you up if you deviate from standard treatment. And they've been getting pretty fierce about that. That's all true. Uh, and not all of it's been unjustified. In the past 20, 30 years, medicine's come up with stunningly remarkable positive advances. When came into medicine in the 70s, 1970s and 80s, childhood, there was a death sentence. Now we're curing these kids left and right. It's a miracle. And the clot busting drugs that can stop a stroke or, in mid-evolution. It's a miracle. It's wonderful. The new eye implant, cataract surgery, hip replacement surgery, these are miracles. They're wonderful advances. And but it lets big medicine stand say, see, this is our power. Don't even you mere frontline primary care doctors don't need to challenge us by telling your patients to eat differently or whatever. If we think that food's important, we'll let you know there. And so, so along with that rise of very powerful advances, there's also become similar to our politics. There's more testosterone, if you will, in the medical establishment, and they swing their power around in a pretty fearsome way. And many doctors are intimidated, or certainly inhibited from fighting on their own. But the other side of that is you and all the podcasters and what's available on the internet, and how many doctors are now coming to the American Lifestyle Medicine meetings, to Dr. Neil Barnard's meetings, Dr. the Nutrition Project meetings, the international um, plant-based medicine and healthcare conferences. Really, hundreds and hundreds of doctors from around the world come to these meetings. We're constantly talking to each other on the internet. And they say keep a napkin in a cloth bag for very long. The point comes out. And the truth is that these are largely diseases of interest to lifestyle, and a healthy plant-based diet will reverse most of these diseases. That word that lion is afoot, has been let out of the bag and is prowling the countryside of medical thought now. And so slowly, hopefully not too slowly, we're trying to encourage doctors to realize that you can help your patients regain their health in a way that medical establishments not even on their radar. So it's a fascinating time to be working in this arena for both of us because, yes, I'm a practicing doctor, but you are healing more people by getting this information out to them than I'll ever contact. You can reach hundreds, thousands of people with a single podcast, and you can't unring the bell. Once people hear this, it changes what you're seeing. It changes your understanding of health and disease, and more people are willing to go more plant-based in their diet. And, we all benefit when it happens. We're all on the same team there. We're all working. The word doctor comes from the same Latin root as doctor, teacher. We're teachers, basically. And it's a matter of education. We don't need more research showing that plant-based diet will lower your blood sugar. We know that. But what we do need are people being aware of this, and that's the key role that podcasters and educators like you play. So it's good that we're all working team in the same direction.
That was such a powerful statement that you just said about, not being to unring that bell. And so I want you to ring the bell for people who are doubtful about the power of nutrition in, maintaining a healthy lifestyle or healing the body from particular ailments. And, again, as I say, you've been doing this for some time now. If you can share maybe one or two examples of a time where you worked with a patient or individual and their recovery was so astounding that maybe even surprised you to an extent of the power of nutrition, what it was able to do for them.
Oh, thank you. If there's anything I would like your viewers to understand, a couple of things. One, the majority of chronic diseases, the high blood pressure, chronic diabetes, inflammatory diseases, these are reversible diseases. Know that they are not life-threatening. These diseases are reversible with the healthy diet and lifestyle. Two, a whole food plant-based diet. You can't do this on energy drinks and granola bars. You got to be eating the healthy fruits and vegetables, etc. But a whole food plant-based diet and beneficial lifestyle practices, enough sleep, a daily walk, enough love in your life. But a healthy plant-based diet, that's the key to reversing. But when they're reversible, plant-based diet is the key. And you can just bring your doctor on all you have to explain much about the doctor. I'm eating healthier, uh, and probably going to lose some weight. You work with me for my medications if as that becomes evidence. Whether it's diabetes medicine, high blood pressure, or whatever it is. That's all you need to do. All of these reversible things. Plant-based diet is key. And your doctor should or so they can work with you for your medication. Everybody knew that. I could hang out my stuff and go bicycling. So that's really important. As far as the uh, one of the I've seen, I could write a book, and as most of us not lifestyle doctors could. But the most gratifying one is when I've got a couple in the office who clearly they're suffering from these standard government diseases. They were both overweight, high blood pressure, diabetes, and the wife saw programs, very enthusiastic. The husband's sitting there, and he's got his arms folded. He's shaking his head no, he doesn't want any part of it. And all you do is follow them. Everybody is where they are, and some people are ready to, some people aren't. The point is, you never know who is what. You never know who's ready, where they are on any video. And I'm seeing the wife, she had 1 pressure month, and she's doing great. She's losing weight. I'm reducing her medication. She's looking her, she's feeling better. Husband's nowhere to be seen. And then about 9 or 10 months later, I'm walking the exam room, and there they both are. I did not recognize my husband. He had lost so much weight. His eyes were bright, his skin was clear. He jumped up to see me and shake my hand, and he'd been working with another doctor. He was off his medication, and we all went to a big group called God Bless called Good for Them. And you never know the effect that one person surely has on the people around them, which is what was happening with the husband and wife. And so don't count anybody out. The body just doesn't ask a lot from just fit that healthy plant-based diet. Treat it well as far as enough sleep and exercise, and your body will know what to do with that. And you can write your own story of remarkable transformation just by these simple steps. And we outline all of this in our book, Moving Medicine Forward.
You know, the byline in the book is what doctors should know about nutrition. Speak to what both, the average individual and also doctors should understand about nutrition in regards to health and healing, because, I've met many doctors who, if they are honest with you, they will say like, hey, I only had an hour of nutrition while in medical school, becoming a doctor. So what is it that they should know, especially as they're dealing with their patients? What things should they really be paying attention to?
Oh, thank you for that. Basically, the three adages apply to my medical colleagues. One, know that the majority of diseases you are treating day after day in your primary care office, these are diseases from what the patient's eating and how they're living their life. These are diet and lifestyle diseases, and they are reversible. You know that these are reversible diseases. A plant-based diet and healthy lifestyle is the key to reversing them. And Dr. Be ready, those medicines you have their patient on, they are going to be too strong for them. They must be reduced, be prescribed as the patient gets better and healthier. So be prepared to do that. Now, all of this, doctor, makes it important for you to educate yourself because you didn't learn this in med school. Fortunately, there's plenty of information available on the internet. I have it listed in my book, Moving Medicine Forward, but the American College of Lifestyle Medicine has a 5-unit course in fundamentals of nutrition. The Plant Nutrition University.org has 3 courses on plant-based nutrition. There's the University of Winchester online. It's a course on plant-based nutrition. There are books on plant-based nutrition and clinical practice. Physician heal thyself, physician educate thyself on plant-based nutrition. The information is around there. And as I tell the medical students, I'm the happiest doctor I know. My patients get healthy before my eyes. I'm like my colleagues, I'll get them fatter and slicker. Yes, doctor, if you don't talk to them about what they're eating, that's what you're going to see. But it doesn't have to be that way. Now, if you, I tell my medical students, you could become the happiest doctor you know by incorporating the fundamentals into your practice, a healthy diet and lifestyle, and with your patient as their health coach, as their health cheerleader, as their body responds. They less and less need for your medication. I tell my patients I want to see two places only. I want to see a health food store buying your tofu and on the bicycle path when we wave to each other. That's the only 2 places I want to see you. And I give them a wink, of course. They need medical, of course. But basically, live your life. Don't be a professional patient. To reclaim the birthright of health, which belongs to all of us, and you'll be the happiest person to go as well.
And Dr. Klaper, if people are to connect with you in terms of website and social media, where would they find you?
And thank you. First of all, our book is now available on Amazon, but also go to our website, movingmedforward.org, movingmedforward.org, and you'll see everything we're doing there as well. how you can help us get the word out to more medical schools so we can create a new generation of more doctors.
Well, guys, Dr. Klaper, first things first, thank you so much for agreeing to do this interview. I'm looking forward to diving more into the book. I started diving into it within the past week. And for those of you who haven't gotten it as yet, as Dr. Klaper said, you go on Amazon, should be available there. It's an amazing read so far. I'm a few chapters in, but it is a really good flow to it, and you're going to learn a lot. And more than that, perspective wise, you're really going to come away looking at the establishment a little bit differently, with balance, of course, but then also looking at your life and realizing what may need to change. And so, I'm just really thankful for everything, all of your work in general. When Robert first emailed me, I was just ecstatic, because I've been very familiar with your work over the past couple of years. So, Dr. Klaper, thank you so much for joining us on the I Choose Health podcast.
Indeed. Thank you for helping get this important word out. All the best to you and your viewers in the years to come.
Yes, thank you. And guys, thank you for tuning in. This is Stephen Leslie, just reminding you that choosing health is about choosing power, possibility, and purpose. Welcome to week 42 of 52 Choices. We're saying to charge your phone outside the bedroom. Keep your phone out of reach at night, reduces blue light exposure and late night notifications, both of which interfere with melatonin production and sleep quality. Studies show that better sleep improves focus, mood, hormone balance, and metabolic health. Research published in Sleep Health and Nature Human Behavior shows that reduced nighttime phone use leads to longer, deeper sleep and better next day cognitive performance. So try this tonight. Plug your phone in across the room or outside the bedroom and use a regular alarm clock instead. Your brain and body will thank you.